I'm Dr. Samson Kuhora. I'm the acting CEO at NHIF. The purpose of this meeting is basically to bring in different stakeholders. You are aware of the regulations that have been put in the media, and also some of the amendments that are being made to the NHIF Act. So the purpose of this is to have part of the public participation exercise, bring in the big stakeholders, engage them on their resolutions or some of the amendments, and also get their feedback on the same. We've had reports in complaints by the different workers and also different beneficiaries of the fund of being denied services at some of the facilities. I would like to mention that this is actually a violation of the contractual provisions that we have with the hospitals. They've raised the concerns in terms of payments, but we have contractual obligations, and we made it very clear that payments is a continuous process. So there are those which will be pending, will not be able to pay exactly what is required today, but then there is that process. And just to make it a bit more inclusive and to share information, we've had engagements with the providers through the Kenya Healthcare Federation. So it represents all the national referral hospitals, it represents the private providers in the country, and the not-for-profit of the mission hospitals in the country. For the beneficiaries, this is an assurance that we have more than 8,000 contracted providers in the country, and they can be able to access the services that are entitled to at any of these providers. We've made it a bit more formal when it comes to the engagements. Therefore, the scope of service is defined, the reimbursement amounts is defined. When it comes to the scope of cover for the fund is defined, and we are taking it a step further. During these engagements, we'll be seeking to also publish some of the specific benefits that the members are entitled to, so that it's not up for the facilities to decide that you're entitled to this, you're not entitled to this. So those are some of the things that we're expecting to get out of the engagements in public participation exercise. What Brother Toli mentioned is as regards to employer compliance, and there are instances where the employers actually deduct from the employee, but they don't make the remittance. So there is an ongoing exercise that is meant to seal that gap. The estimate that we have at the moment is about 1.07 billion in terms of deductions that have been made or deductions that have not been made and remitted to the fund. So there is an ongoing exercise on employer compliance. It's expected to take about 3 weeks, and the net effect of it is that we expect it to generate about 712 million in revenues from those employers who've not been compliant over the last 3-4 years.